Okay, so in this 10th chapter, we're going to go over protocols for PRF. So we'll talk about membranes, making sticky bone, making extended PRF, making the bio bone. So we're going to review each one of these protocols one by one, and we'll go through kind of the protocols that we use on the centrifuge, and then what you as a clinician has to do step by step thereafter. So the first thing that we should discuss is just making standard platelet-rich fibrin clots. So when we want to do this, it's typically a 3-step procedure. You're always going to centrifuge at the 700 G-force for 8-minute protocol. Remove the lids, wait 5 minutes, and that's to allow for the clot to form. And then you can remove from the tube. So it's very straightforward. Of course, this is what we'll use, for example, for third molars. You know, you don't need to make the plugs. You're just going to make the clots and away you go. So very simply put, like I said, you're just going to wait those 5 minutes. This is obviously the easiest protocol. You spin, after the spin cycle, pop the lids, wait 5 minutes. Of course, here we've spun with the more hydrophilic tubes that we've discussed previously, so you can see the membranes are a little bit bigger. A couple of key concepts with respect to this is that ideally you do not want to remove too much of the red zone layer. So as we've reviewed in chapter 2, that red zone is very rich in cells. And if you do need to remove the red zone, like I said, you can use one of the instruments in the kit just to basically peel it off. One of the things that you definitely do not want to do is that full-size PRF membrane, always remember, the majority of the cells are found here at the bottom. We have to make sure that you're not going to cut the membrane, let's say a quarter of the way up here into the plasma and remove all those cells, because that's the most concentrated area. So that's the protocol to make a simple PRF clot. When we go to making PRF membranes, of course, we're going to do something very similar. So we're going to centrifuge at the 700 RCF for 8 minutes. We're going to remove the lids. And then thereafter, we're going to place it in the Bio-PRF box and we're going to compress. And then the membranes will be ready to use. So again, here, it's the same first step, right? So we're not going to review this in full, but again, you're going to want a full-size membrane. You might have a little bit of the red buffy coat zone in there. You pull the membranes. Once they're pulled, then they're going to be flattened. So here we're going to use the PRF compression tray. You're going to place it over top and you're going to leave it there. And this you can leave for 30, 40 minutes while you go into surgery, etc. And then when you're done, like I said, the next step is to pull the lids up. Always remember, make sure that they're not stuck on the upper portion of that. So when that's done, like I said, it's flattened out the membranes and then we can use these membranes thereafter. So I'm just going to take a few of them out here and just place them on the tray just so people can see what they look like. So when you pull these, you can see they're typically 1 to 2 millimeters in thickness, and this is typically what we're going to utilize in future chapters in clinics when we're doing a lot of the GBR procedures, and these membranes will be laid flat over the healing sites. Okay, so this is to make PRF membranes, very, very commonly utilized procedure in dentistry. So that's what they look like there. Again, nice little PRF slugs there. The third protocol, we're going to make PRF plugs, and this will be used for extraction sockets. So again, very similar protocol, but now instead of using the compression tray to flatten the membranes, we're going to place them in the cylinders and then we're going to compress. So again, membranes are going to come out here. Exact same thing, right? You're going to wait the 5 minutes as we've discussed. Then you're going to make sure that you keep a little portion of that red buffy coat zone. And the difference between this step here now and the previous one is we're not going to flatten out the membranes. This time here, we're going to take them, we're going to place them in the little cylinders. Once they're in the cylinders, we're going to compress them with the piston. Okay, so we'll do 2 little demonstrations here so that you guys can see. 1, 2, that's typically we'll need 2 for premolar, maybe 3, 4. Rule of thumb, pack as many as you can in these extraction sites. Now this right here, like I said, is a procedure that we'll review later, but with extraction sockets, it may lead to more dimensional change when compared to using an allograft, for instance. So if you live in the United States, more commonly, people will use the allograft bone for the extraction sites. And however, you can use this compressed plug for the soft tissue. So you can place this over top, and we'll review that a little bit later in the extraction socket section. So there they are there, and then we'll go to the next protocol now. Drawing liquid PRF, we've reviewed this very briefly in chapter 2. When you draw PRF, remember the protocol is slower, so 300 RCF for 5 minutes to concentrate. and we're going to use the white or blue lids here. So this is going to be not the red tubes now, we're going to use the liquid plastic PET tubes. Do not pop the lids in this case because it's going to start the clotting cascade. Use an 18 gauge needle, 1.5 inch. You're going to pop through the lid and then you'll draw out the liquid platelet-rich fibrin, and then the liquid PRF is ready for use. So here, the example here, nice little video. Again, you can see at the buffy coat zone, and you're going to see there, that's where the cells are. And I'm just explaining in this video here that you're going to pop through the lid. Once you're through the lid, then you're going to collect the liquid out. So here you're going to see we're going to draw up the liquid. And when the liquid is drawn, then we can use that for, we're going to use that. So that's how you draw it. Okay? Again, very important to go right to the buffy coat zone. One of the things that I see more commonly is people will just take out the upper half of the liquid platelet-rich fibrin. Always remember that it's the lower half that's a lot more concentrated. And again, if you have a few red blood cells, as you see here, no big deal there by performing it that way. Now, when you want to make a biograft, so what is a biograft? It's essentially a larger PRF membrane. And when we do this, we're going to use custom trays and we're going to make a biological graft essentially. Okay, so this is for medical doctors, for instance, that want to use PRF for large diabetic ulcers. You're going to centrifuge at the 700G protocol for 8 minutes, but you're going to use the white blue tubes. In this case here, you're going to use an 18 gauge needle to draw up the liquid again, draw it up, and then place it immediately before it clots within the custom trays. And then let it set for 15 minutes, okay? And then the biograft is going to be ready for use. So we're going to play a few videos here so that people can see. In these cases here, you can pop the lids. There's no issues with that. You can use, whether you want to use a syringe or not, it's fine. Like I said, a lot of times we'll grab this and draw it out without the actual needle on, simply because it's a little bit faster. Because again, you're going to take the entire liquid. Now, if you grab a little bit of the red, no big deal. Like I said, the red portion is very rich as well, as we reviewed in chapter 2. So I'm going to use 2 tubes here to make a quite large membrane. And so you're going to see this here. I'm drawing it out and simply placing it in the custom tray. Okay, so here we go. And then when that's done, usually what I typically do is I just shake up the custom tray a little bit just to get, you know, an even distribution of the cells. So that's all I do, a little shake, and then we're ready. Now, here's the same video just from a different angle because I want people to be able to see this very precisely. Again, we're going to go in, we're going to draw up the liquid PRF, okay, and again, that's the first amount. Again, this time here we're going to grab a little bit of the red, which is going to be no big deal. And then the second one here. Very good. Okay, so the second one's being placed there. So the biggest key to this step, and for those that are new to this, is that you want to allow this to set, and that takes typically 15 minutes or so. What I find people, again, shake it a little bit, what people do a little bit too quickly is that they try and remove it too early, and if you do that, the problem with doing that is that sometimes the membrane won't be fully formed and will not be as strong as expected. So if you wait these 15 minutes, now we're going to go through another video here, and we're going to see what it looks like. So 15 minutes later, now it's clotted. So I always use an instrument and go around the edges, and then I peel this off. Okay? So that's how this is done. And from here, we're able to remove this and put it down on the tray. Okay? So that's the circle that we created, right? So you can see that there. And that's your biograft. So again, this is from a different angle, the exact same video, where I'm going to remove this. And like I said, these are typically utilized in medicine. And people will also use them in dentistry. If you want to do a large GBR procedure and you simply want to cover a wound, example, this can be utilized and very useful as well for gingival grafting procedures if you want to have a larger clot here. So there it is there, it's going to be placed on there. Okay, so we're going to just watch this video, that's what it looks like. Okay, so that's the video there, you can see it. That is formed with a fibrin clot that's from your own blood, and you can cover wounds with this. It's got a lot of growth factors, and we'll see in later chapters how this can be utilized basically for healing. Okay, so it's quite interesting. Like I said, a lot of people are not aware of this kind of technology that exists, but this is a much better way to try and make larger membranes, for instance, as opposed to making a bunch of the flat membranes. Just make a big one, okay, which is much, much easier to use, and then you can use it thereafter. When we want to make sticky bone, protocol is a little bit more extensive. So again, we're going to centrifuge 700 RCF for 8 minutes using 2 white blue tubes, so that's the plastic tubes, and 2 to 4 red tubes. Always draw the liquid tubes first. Then we're going to remove the lids of the red tubes and wait 5 minutes. Okay, then you can remove them from the tube. You place them in the Bio-PRF box, you compress them, so we've already reviewed all this. Then we can cut up 2 membranes into the Bio-PRF bowl, and we can mix with the allograft, and the allograft is preferred, and we'll explain why. Then you can take the 18 gauge needles, drop the liquid PRF, mix them together, and then you have your graft complex that's made in a few seconds. So this will actually set rather rapidly, and the allograft really helps with this. Then the sticky bone's ready. Okay, so again, to review the protocol, you're going to spin 700 G for 8 minutes. Always remember that the white tubes are drawn first, then they're going to go into the PRF box. When they are into the PRF box, the next step, of course, is to make the membranes. So we've reviewed this. The reason why we do this is basically just to compress out all the liquid and just to get the fibrin a little bit more compact. So we're going to go through that procedure there. Then whenever we lift, always remember, like I said, make sure you take a look at the lids, then your membranes are ready. Okay, so from this point forward, the membranes are now ready. The next step is then to take the membrane and bring them to the PRF bowl. I like to use typically 2 membranes, and then I'll mix this with the allograft. Now the advantage here is that you can also make sticky bone with just the liquid platelet-rich fibrin, but by introducing ahead of time a couple of these PRF membranes, the fibrin clot is already formed, and the advantage here is that when you add liquid fibrinogen and thrombin to fibrin that's already been formed here, it'll actually make the fibrin clot a little bit faster and a little bit more dense. So I always say that a fibrin membrane will act as a nucleus center, so to speak, for the liquid platelet-rich fibrin, and it makes a better membrane. Now, we always use allografts in here, or any kind of bone graft that has a little bit of collagen is preferred. And that actually helps the sticky bone make more consistently. So if you're one of these people that makes sticky bone and you're finding that the consistency of the sticky bone, it's not really sticky, or it's, particles are flying out, etc. If you make the same protocol but you use a xenograft, the xenograft doesn't make a sticky bone as effectively, and that's mainly because it's deproteinized. No protein, no collagen in the bioos, so to speak. And so the liquid platelet-rich fibrin here will form a much better matrix when you have both the allograft as well as the PRF membrane fragments that are cut up into small pieces. So that's a nice little protocol here for the sticky bone. And again, when you're finished with this, you're going to get something that's nice, consistently dense, and then this can be utilized, for example, to insert into a sinus, or can be utilized for GBR procedures, grafting procedures, extraction sockets, and we'll review all that in future chapters. Okay, so there it is there, quite nice, and nice to work with as a clinician. When you want to draw the CPRF, so we reviewed this in protocol number, chapter number 3, sorry. In this protocol here, you have to make sure that you spin faster in the white tubes and the blue tubes. Make sure, of course, you do not use the red tubes. It has to be done in the liquid PRF tubes. Now, a small little trick that we're going to go over here. When you use the 18 gauge needle, the best thing you can do is, instead of like in the previous video where we used to take the needles and the syringe and we'd go all the way down and we try and take out a little bit of that CPRF layer, what we call it, it's very challenging to do that. And this technique here that I'm showing here is much more effective, and I'll explain why in the video. What we're going to do instead is we're going to take that 18 gauge needle, remove the upper 3 to 4 mLs of liquid PPP. We're going to discard this upper layer, and then we're going to collect the remaining 0.5 to 1 ml layer, okay? And from there, it's then going to be ready. So if we go over the video, I'm explaining here again, this is a different way of doing it, but it's a lot more effective than I showed in chapter 3. We're going to pop the lid, and I actually learned this technique from the PRP experts, and this was Dr. Arun Garg. I saw him doing this one time with PRP, and I said, that's how everybody should be doing it, even with platelet-rich fibrin. So I have to give him credit, of course, for the technique. So you remove the upper platelet pore layer. Then when there's 0.5 to 1 ml left of the very rich, the concentrated PRF, you're then going to draw this up. And this is going to be about 0.5 to 1 ml, somewhere in there. That's where all the cells are. That's going to be a lot more concentrated than the liquid iPRF, okay? And again, as we reviewed, there could be a little bit of red blood cells that are incorporated in there, and there's no issue with that. So again, we're going to go over that. When you look at this video, you can actually see a little bit of the white there. That's where the cells are. So you're going to draw up this upper layer, okay? You take out the top 3-4 mLs, and then you're going to discard it, so you can just put it in the PRF bowl. When there's about 1 ml left, then you're going to take this very rich layer, and as we reviewed previously in chapter 3, this is concentrated, like I said, about 15 to 16 times the platelet count from baseline, whereas typical iPRF is usually 2 to 3-fold. So there's a big difference here. And like I said, we'll take a little bit of the red blood cells as we reviewed in chapter 3. Okay, so that's how that's done. You can see there I got about 0.5 to 1 ml, somewhere around 1 ml roughly. That's typically what we're looking for when we draw the cPRF. Now, making the biofiller. These are protocols that are used in facial aesthetics. This is when we want to heat the plasma, so now we're going to include the bioheat technology within these steps, and there's a little bit more to do here. So first thing we're going to do is we're going to centrifuge at 700 RCF for 8 minutes in the white tubes only, no red tubes here. Then we're going to take out the upper layer with an 18 gauge needle, remove roughly 2 mLs, okay, of the liquid PPP. Then we're going to place the blue caps on the syringes, and we're going to place it in the bioheat device for 10 minutes at 75 degrees Celsius. The remaining tubes that still have the lids on, we're going to place in the BioCool device, and we're going to show you what that is. That's utilized to prevent clotting. So if it stays at the temperature of the BioCool, it's actually designed purposely to keep the liquid PRF from clotting, and that'll basically double the working properties of a liquid PRF. After the 10 minutes of heating, that PPP layer turns into what we call albumin gel, and you're going to see the consistency, it's different. We're going to then take the albumin gel and place it into the BioCool for 1 to 2 minutes, and that's basically just to cool it. And then from there, we're going to take the remaining 0.5 to 1 ml cPRF that we've previously seen, and then we're going to mix them together. The advantage of doing it this way is that we have the albumin gel, and this has the extended working properties as we saw in chapter 7. So this will last 4 to 6 months. And we combine that with the liquid cPRF, the very rich layer of cells that we saw in chapter 3. And thereafter, we're ready to inject and use it as a biofiller. Okay? So let's go over the protocol here. So as I mentioned, the first step is we're going to draw the upper 1.5 to 2 mLs of this liquid. So this is the first step. We're going to take this off, okay? You got about 1.5 to 2 cc's there. I'm going to do 2 tubes here. So we're going to do 2 bioheat. Okay, so we're going to draw this up. And then from there, we're going to then place this into the bioheat. Okay, always remember that these 2 tubes are then going to go into the BioCool. And that is simply to extend the working properties of this device. So that's of the liquid platelet-rich fibrin. Now, the blue caps, for those that have never seen these before, all that they're meant for is to basically prevent the liquid PRF from soaking or running out into the bioheat device. So these little blue things here, when you attach them, okay, it's just a little end. Now the liquid cannot go out, and then we're going to place that into the middle layer of the bioheat device. And that's set at 75 degrees Celsius, right? And that's going to run for 10 minutes. So again, there's a little blue end. We're going to pull that out. We're going to place it in the bio heat. Away it goes. Okay, and there it is. Okay. When this is done, now we have the bio heat. Okay, look at the texture. It's quite different than liquid platelet-rich fibrin. It's going to go directly into that area. So anytime we have any kind of bio heat, so I've drawn 4 here, you always have to cool it because at 75 degrees Celsius, if you mix that with liquid platelet-rich fibrin, it will actually destroy the cells. Now with the remaining, so now the top 2 mLs have been taken out. Now we're going to pop the lids of this and we're going to take that rich PRF layer. So in this video here, you're going to see we're going to draw up the liquid as much as we can to that buffy coat layer. We're going to draw about 1 cc, and that's where most of the cells and growth factors are going to be. And then we're going to take this female-female lure lock. This is going to be pulled out. We're going to remove the needle here, and we're going to mix the albumin gel with the liquid PRF, okay? And that's how we're going to create the ALB-PRF, which stands for albumin gel and liquid PRF, or we also just refer to it very simply as ePRF for extended PRF. And that's what we're going to inject as a facial filler. Okay, so here, again, for those that have never seen this, we're just going to mix back and forth both of these devices. And usually you need to mix it probably 10 times back and forth. But the nice thing about it is if you do have a little bit of the red blood cells, you can see the colors changing. Okay, so you can now see that it's getting mixed, and we just keep going back and forth nice and gently a few times, and then it's ready to be injected. Okay, after that you're going to put whatever gauge needle you want to inject. So typically we recommend 25 to 27 gauge, and then you're ready to do a biofiller injection. Okay, so that's how that technique there is designed. Again, it's going to go through the mixing step again here. So lid comes off. Just to recap again, we're going to take the PRF layer, so that's the rich layer here, and there's a little bit of red blood cells there. Once that is done, we're then going to take the female to female lure lock. Okay, and this female to female lure lock now is going to be opened, and we're going to connect it both to the albumin gel as well as the liquid PRF. Okay, so here we're going to remove the needle. And now the liquid PRF, that's the liquid PRF from the concentrated portion at the buffy coat, is going to be attached on one side. We're going to go to the biocool, and I'm pulling out here the albumin gel, which has now been cooled. So now it's down to a normal temperature, and then they can be mixed together. And when we mix them, okay, we're going to make sure that we continue to mix until the red portion and the plasma layer, the albumin gel, are the same color. Okay, so you can still see that there's a little bit of differences there. So we're just going to go back and forth, and I find from experience, typically you require about 10 mixes here. And then once that's done, we remove it. You can attach to it whatever gauge needle you want to do your injections. We typically recommend 25 to 27 gauge, and you're ready to go. Okay, so that's the biofiller. When we want to make PRF membranes, it's very similar, in fact, to the previous protocol. So we'll go through it. The main difference is that we're going to mix, instead of using the female to female lure lock, it's going to be mixed inside a custom tray. So here's the centrifuge. We're going to centrifuge for 700 RCF for 8 minutes, again in the white tube, so no red tubes at all for this. You're going to remove, once again, with an 18 gauge needle, the upper 2 mLs, and that's going to be placed into the bioheat. Okay. Once it's heated for 10 minutes at 75 degrees Celsius, always remember to place the liquid PRF that's remaining into the biocool, and that's going to prevent the clotting. After this 10-minute heating period, now you've created albumin gel. That albumin gel needs to be cooled, so you place it in the biocool for a couple minutes. And then after that, you're going to take the albumin gel and you're just going to lay it out into the bioheat tray, and that's the custom tray. Once that's placed there, you're going to lay it flat and just compress it basically, and then you're going to add in some of the liquid platelet-rich fibrin, okay, from the PRF layer. Then you're going to allow that to clot. That'll take about 15 minutes, and then you're ready and you've created an PRF membrane. These are the membranes that'll typically last 4 to 6 months. So let's go through the videos here. So again, we've actually utilized on purpose the same videos just to show colleagues that it's exactly the same protocol here. So you're going to draw up the first 2 mLs, and I'm going to do this here with 2 tubes. Okay, so we're going to draw 2 times the upper PPP layer, so the upper 2 mLs, and there's no platelets here, right? Very few platelets. The platelets are typically at the Buffy coat zone. Once this is done, as we've seen previously, okay, we're going to place them in the biocool, and that's going to allow this to extend the working properties of the liquid. So instead of clotting in 15 minutes, it'll clot in 30, 40 minutes. Then we're going to take these blue end pieces, and these are simply utilized because we want to prevent the liquid PRF from leaking out into our bio heat machine. Of course, we have to make sure that nothing comes out there. So we're going to place that on. And then you can see it's got an end cap, and then that goes into the middle layer of the bioheat. The bioheat is set for 75 degrees Celsius for 10 minutes. Okay, so here's the second one. Okay, so that's going to now heat for 10 minutes. While that's heating, we have to make sure that the other layer, the CPRF layer, is in the biocool. When this is done, immediately what we do is we take this out and we send this directly to the biocool, right? So once we have that, it goes into the biocool, and it's going to then wait for 2 minutes to cool down. During this time, we could take the tubes, the other ones, the CPRF, and collect the CPRF layer. Now, during this video here, what you're going to see is I'm going to design and place this into the custom tray. Okay, so this is going to be placed into the custom tray. When it's placed in the custom tray, you're then going to basically compress this. Okay, so you're just going to find a way to flatten it down at the base. This is one way of doing it. Or you can use, which probably even a little bit better, is a little compactor. For extraction sites, when you compact the bone graft, you can use that as well, basically just to compress this. Okay, so now we're going to draw the liquid PRF layer. Once that's drawn, we're going to place it in there. It could be a little bit of red there, no issue at all. Okay, and then you're going to let that set for 15 minutes. Okay, again, just mix it up a little bit, and we'll go through the videos of when this is done. So again, here's another little video that's going to explain the procedure. So again, first step, we're going to place the albumin gel into the bottom layer, and then we're going to use a little instrument to basically compact this. And I prefer to use actually that little compactor on the side. It's probably a little bit more effective to do this. Okay, but essentially what you want to do is you just want to make sure that it's evenly distributed on the bottom layer here. So you want a nice even layer, and that's going to be your membrane of albumin gel. After this is done, you're then going to draw the liquid PRF. Okay, so here we are. We're going to draw up the liquid PRF. And in this case here, you're going to draw up the liquid, maybe a little bit of red blood cells. Okay, because we know that the red zone of the Buffy coat is very, very rich. It's going to be applied there, and from there you're going to make your PRF membrane. Now when you actually look at this membrane, at the very end after 15 minutes, you can see that it's very similar to a normal membrane in consistency, okay, but it's got a little bit of albumin incorporation into it. Okay, so you can use it and work with it. It's actually stronger than people think, and when you look at it, you can see that it's a membrane that can be used. That's what can be covered onto titanium, etc., and utilized for different grafting procedures. Now, when we want to make the biobone, okay, when we make the biobone, this is very similar to the last step, but all we're going to do now is we're going to add some grafting material. So it's exactly the same steps as the PRF, but now we're going to centrifuge for 700 RCF like before for 8 minutes in the white blue tubes. We're going to use the 18 gauge needle. We're going to remove the upper 2 mLs. We're then going to place everything into the bioheat the same way with the blue caps and this is going to be done for 10 minutes at 75 degrees Celsius. Once that's done, the main tubes, blue tubes, are going to go into the biocool. The other syringes are going to go into the bioheat and heat for 10 minutes. When that's done, we've created albumin gel. We then cool that for 2 minutes in the biocool, and once that's done, we're going to place that into the custom tray, followed by the layer of liquid PRF. But now what's different is we're going to add the allograft. So add one layer of the allograft bone and then a little bit more liquid PRF, and that's what's going to make the sticky bone over top of the ePRF membrane. So the advantage of this technique here is that you're going to make a sticky bone, but the sticky bone has the outer extended PRF membrane built into it. Okay? So again, we're going to go through the protocols, and on purpose, I'm sharing with you guys the exact same videos, just so that people know that it's literally exactly the same steps. So you're going to draw out that liquid PRF in the exact same way, the upper layer, so it's the PPP layer, liquid platelet pore layer. Okay, so that upper layer doesn't have as many cells as the bottom portion, closer to the CPRF layer. When that's drawn out, again, what are we going to do? We're going to take our blue lids, okay, so we're going to take our blue caps and place them on the syringes. At the same time, we have to make sure that those go into the biocool. Okay, so that's going to extend the working properties of the liquid PRF. Okay, here come the blue lids. Okay, that's going to go in the middle layer. And that's obviously placed in the bioheat. Now we got to wait the 10 minutes. So during that 10-minute period, like I said, that's going to turn into albumin gel. When that's completed, we can then take out the albumin gel. You can see it's a different consistency. That's hot, so we can't mix it right away with the liquid PRF. We have to cool it, and that cooling process is going to be conducted for 1 to 2 minutes. Okay, so that's exactly the same thing as the other steps. Now, just like the previous video, the next step is to place the extended PRF or the albumin gel and make an ePRF membrane, right? So that's the first step. So what we're going to do here is we're going to take the albumin gel and we're going to place it into the custom tray. Perfect. And we have to make sure that it's well spread out there. So that's the instrument that I actually prefer to use. This is the little compactor, and it works very, very well for this application. And all you're going to do is you're going to compact it densely, so that once that's done, then you're going to draw up the liquid CPRF. So the next step, of course, is to take the concentrated layer, and then when we draw this layer out, we're going to apply it onto the albumin gel, and that's going to allow that membrane to clot. Okay, so that's where the fibrinogen and thrombin come into play and help with the clotting process. Again, you can take a little bit of the red, there's no issue there. Okay, once that's done, that's going to clot. And before it's done clotting, what we can do now is we can introduce the allograft bone. And the advantage of this technique here is that we can combine the sticky bone that we're used to working with from before with an outer extended PRF membrane. Okay, so again, what I'm going to do here is use that little compactor again, and I'm just going to make sure that it's evenly distributed, the allograft. And depending on the size of the augmentation procedure that you're going to be performing, that's how much bone you're going to utilize. So if I need to make a large 5 millimeter augmentation horizontally, then I have to make sure that I have 5 millimeters of bone allograft, of course. And you can extend the thickness here based on how much you're going to load it. When that's done, now you need to reintroduce the liquid platelet-rich fibrin, okay? And that's going to be performed here. You're going to draw up the liquid PRF, and that's a normal standard liquid PRF tube. So that's the white cap, the blue cap, etc. And we're just going to apply it a little bit everywhere. Okay, and then you can, again, use your little compression compactor tool to basically make sure that the allograft is incorporated in there. Once this is done, all you need to do following this is simply to wait the 15 minutes. Like I said, this is something that you can prepare at the very beginning of surgery, and then you can come back in 15 minutes when you're ready and utilize it. And the nice thing about this is that one side is composed of the actual layer, the sticky bone, which can go against bone, and the other side is for the extended PRF membrane. So here's another video that's just going to go over this once again. So here, first step, like I said, is to apply the albumin gel. So I'm showing double videos from two different angles simply to educate doctors that are watching this. That way they're confident that they can do this in their offices. So again, first step, we're placing the albumin gel. Okay, that's then going to be compacted. Okay, so we're going to compact this. Afterwards, we're going to add the liquid platelet-rich fibrin. So this is the PRF layer that we're used to working with. So you see it there. We can pop the lids, no problem, because we want it to clot now. We're going to grab our 18-gauge needle. We're going to go right to the buffy coat zone. Okay, so you're going to draw out that liquid platelet-rich fibrin, or the liquid PRF, I should say. It's then going to be applied. Okay, so now we've made our PRF membrane. If you wanted to make an PRF membrane, you'd stop here, you'd let that clot for 15 minutes. Now what's different here is now, before this clots, we're going to incorporate sticky bone with this. So we're going to take the sticky bone and we're going to incorporate it here. Okay, so we're going to add some bone allograft, and then we're going to use the compactor again, and we're just going to flatten this out. Okay, so we're going to make sure that this is nice and flat. I'm going to add a little bit more here. Okay, we're going to flatten it out again, and then we're going to add the liquid platelet-rich fibrin. Okay, so that's how that's done. Okay, and then we're going to introduce the liquid PRF. And that can be, like I said, we typically, when we want to make the biobone, I'll always draw 1 or 2 tubes extra of the liquid PRF, a full-size liquid PRF tube, on purpose, just because I know that this will require a little bit more liquid PRF than just the PRF layer. So here, make sure you get enough liquid PRF in there, and then, like I said, you're going to compact it down, make sure all the allografts are soaked in there, and then we'll go over what it looks like at the very end. Okay, so you'll see a little video. Okay, so I just make sure all the allografts are soaked in there. And the advantage is the base of this is the PRF membrane, and then at the top, what you see here is going to be the sticky bone that's going to be formed. Okay, so when we take this out, it's exactly the same thing. We're just going to cut away at the edges. Okay, and again, a mistake that people make is to try and take this out, after a minute. This right here requires probably 10 to 15 minutes. So again, do it early in your surgical procedures. And then when you take it out, okay, you'll get something that looks a little bit like that. And then you can shape it or you can cut it, do whatever you want with it. But what you see here is now you've got the sticky bone there that's at the top. And then you also have on the other side, and I'll get it and lift it up here just so you guys can see it. On the base side, you have the extended PRF membrane. Okay, so you got an extended PRF membrane that's there. There's all your albumin gels. That's not actually allograft particles. That's the actual albumin there. And then that can be utilized for grafting procedure. And the nice thing about this is it's got the sticky bone and it's got the outer layer that's built into it. And they're actually a lot tougher than they look. So like I said, this right here you can utilize, bring it to your ridge and just literally lay it flat on the ridge, making sure that the sticky bone side is going on the right side. So again, here's another little video so you can see it coming out. Okay, I want to make sure that we shape it correctly, just keep it all intact. And the benefit, and this can be used, for example, in a sinus grafting procedure as well, where the extended PRF membrane can go up against the Schneiderian membrane, for instance, just to prevent it from interacting with the bone here. But in any event, that's what it looks like. More commonly utilized for GBR procedures, of course, where you apply the sticky bone directly on the ridge, and then the outer surface can be utilized thereafter for extended PRF membrane. Okay, so that's what it looks like. Like I said, it's basically got the same properties of having an outer collagen membrane, but it's made all naturally. It's got the extended properties where it's going to last 4 to 6 months, that outer membrane, and produced for only a few dollars, right? So this did not cost a lot of extra money to produce. So that's the BioBone protocol there. So that concludes this 10th chapter, and it reviews all the different protocols. So in it, like I said, we reviewed how to make the standard sticky bone, solid PRF, membranes, etc., but also talked about more recently the biofillers and the BioBone and the ePRF membranes and some more recent things that we're working on. So thank you for listening, and we'll now discuss some of the protocols that we use in clinics. Thank you.